If you're struggling with pelvic or pubic pain where it feels like your pelvis is being pulled or ripped in half, this video is for you. Why exercises aren't helping you with your pain and what you can do about it. Exercises are just kind of like a band-aid. They're not addressing what is going on with your pelvis. So why do you have this pain? What is happening and what do you have to do? The pain is coming from an instability in your pelvis. So it's coming from in the front of your pelvis here, there's a joint and it's shifting. And that shift creates so much pain, discomfort. It could be sharp, stabbing. Some moms explain it as like a very deep bruise or like someone took a baseball bat to them. These are things I've heard out of mom's mouth. It's not comfortable. So if this is what's happening, we need to be able to provide support to the pelvis so it's no longer shifting when you do movement, okay? Exercises don't come first, actually. This is why exercises probably aren't fixing your pain, or you do them and then immediately after you're having pain and discomfort. This is why I created the BSR method. The BSR method starts with the basics of your pelvic floor, and then it teaches you how to support your pelvis before you've even done any exercise. Then you're going to restore strength and stability within your body, which just means fancy word for then we'll add in some exercises if we need to keep everything strong and working together. If you've ever done a group project where you have like one or two people who do all of the work and everybody gets credit for it, or vice versa, right? Like you have 5 people doing all of the work and the 2 people don't get credit for it and they didn't do anything. That's essentially what your muscles can be doing. Your pelvic floor is acting as a hammock to your bladder, bowel, and uterus, which means during pregnancy, it's supporting your baby. It doesn't always need to be stronger. It needs to be supported, okay? So especially as you get into the 3rd trimester and your baby becomes heavier, it needs to be supported from your core. It makes up the bottom of your core. So if your core is not working or you haven't done anything with your core during pregnancy, your pelvic floor is taking up all of that responsibility and pressure. Your glutes also are another piece to this, but so often we aren't really using our glutes. We're shortening them. We're like standing with our bellies underneath us, like tucked under. We clench our butt all the time, or we're just trying to do strengthening without teaching the glutes how to lengthen. So we can't strengthen something that's tight. We have to be able to teach it how to relax and let go, and then we can make it strong again. This is why this is really important to start with the basics of your pelvic floor. Learning how to breathe correctly, learning how to tighten your core and really make sure your core is strong. Teaching your pelvic floor not to necessarily contract, but teaching your pelvic floor how to relax. Relaxation is more important for so many women and moms than it is to contract it because it's stuck in a state of contraction. This is the most common issue with pelvic floors, is that you don't need more Kegels. You have got to stop doing Kegels. Your muscles are tight and overworked. What they need is they need to relax and they need support from the surrounding muscles. This is where we need to add in or modify our activity. Before we even do exercises, we need to decrease the pain so then we can eventually get into exercises and restoring the strength and stability of your body. So that way you can feel good and you can roll over again and you can walk and you can get dressed without having pain or discomfort. So this is what we're gonna do. I'm gonna teach you how to put on pants if you are having pelvic or pubic pain. One little trick that you can do so you have a little bit less pain, because a lot of times getting dressed is one of the biggest. Getting dressed, rolling over, and walking are the 3 biggest complaints when you're having pubic pain. So let's talk about getting dressed when you're having pelvic or pubic pain. I don't have a pair of pants, but we're just gonna pretend. So you need to sit down. First and foremost, you have to sit your butt down. When you sit down, now you're taking the weight off of your legs and you're not having to have as much support from your pelvis to do this. The other thing we wanna do is we don't wanna just bring our leg up to put our pants on, because that immediately is causing the pain in your pelvis. So something you can do is trying to turn your foot a little bit, right? We're also getting into the warm months, so maybe you don't have to put on these crazy pants and socks all the time. If you need help with your socks, just have your husband put them on, okay? So to put on your pants, just gently put your legs sideways, turn your knee out just a little bit. So we're not really changing the direction of our pelvis where that instability is taking place. We're just gently going to the side. Everything is in one place. So gently to the side, and then if you need to, you can pick it up with your knees still a little bit to the side, or place it on your leg so it's supported. If this is painful, then we'll have to adjust and do a different way. But this is one of the most common ways that you can get dressed with a little bit less pain. It might still be painful, but it should be less painful, okay? And then you can put on your pants, so you get one leg, and then you'll switch. You can turn that leg out. If you need to, put it on your leg, do the other leg, and then pull your pants on, Okay, so instead of doing the single leg, pulling one knee to the chest, you want to change how you do things so that way you have less pain, and then we can work on supporting your pelvis. But in order to support your pelvis, we have to go to the basics of your pelvic floor. Learning how to breathe correctly, because so many mamas don't breathe correctly. Learning how to engage your core or tighten your core, which so many moms, again, think they're doing it right, but they're not. And so when you learn how to do these things appropriately, you have so much less pain, and it makes it so much easier for you to get through your day. If you are wanting to be able to find relief, there's a 5-minute Mama Relief Challenge taking place. You can use the link down below and sign up. It's 5-minute Mama Relief Challenge where you just 5 minutes a day for 5 days, you're going to learn something new each day. You're going to learn setting the foundation of this BSR method that I keep talking about, and it's going to help you feel so much better in your body. So whether you are currently pregnant and you are struggling with pubic or pelvic pain and it hurts to roll over and walk and get dressed and you're just hoping that postpartum it gets better, I don't mean to be mean when I say this, but it doesn't just go away. This pain doesn't just get better because your baby's been born. This pain is going to still be there because the instability is still there. The instability is not there because you're pregnant or because you have hormones. Those things add to the pain that you have, okay? And so if there's another pregnancy or there's other things, you're gonna notice that this pain gets more intense and it happens sooner in another pregnancy. I want you to feel relief now, not later. I want you to have a better birth experience, and I want you to recover a lot easier without having this pain by taking care of the pain right now. So join the 5-minute Mama Relief Challenge. If you are postpartum and you're still struggling with this pain, the 5-minute Mama Relief Challenge is for pregnant and postpartum mamas. We are going over the basics, and we're teaching you how, just 5 minutes a day, you can feel relief in your body and you can feel stronger, more comfortable, and more confident. So click the link below, 5-minute Mama Relief Challenge, and join us. We get started on June 15th, and it's 5 days, 5 minutes. That's it. That's the biggest commitment, and you are watching this video that's longer than that. So if you can sit through this video, you can do this 5-minute Mama Relief Challenge, and I'm going to support you every step of the way, and I'm going to cheer you on and celebrate you. So join below. I'm so excited to have you, and I will see you soon.